Hello and what's up, beautiful people? This is your tooth doctor, Maureen Mora here. Welcome back again to my YouTube channel. If it is your first time coming across this channel, feel most welcome. All we do here is talk matters oral health, and it's simply because I do believe everybody is entitled to good oral status. So guys, I did a previous video on root canal explained, and someone asked me a question: what if they decide to get an extraction done instead of getting a root canal? Which is better between the two? So I thought of the question and felt like, why not do a video to help those people out there, because I know for sure most people are stuck between getting a root canal and an extraction done. So that's why today I've decided I want you to stay tuned as I ventilate on the pros and the cons of either getting a root canal or an extraction done. So before getting onto the video, the only way, the best way to achieve this, to make a good decision on whether to get a root canal or an extraction done, for sure you need a good qualified dental practitioner who is going to give you genuine professional information, especially when you are in this situation, stuck between the two. And please, I will want to urge you, stop basing your decisions on your friends, your relatives, or someone else's previous experience. Honestly, you cannot compare dental treatments. As much as that particular person had an issue similar to yours, dental treatments are different, so that is why I really insist that you need a good qualified practitioner who will guide you through. So once your tooth is decayed or damaged extensively, there are a couple of procedures that your dentist can decide to go. But in today's video, I want to majorly focus on the two. That is either getting a root canal done, which entails saving your tooth, or an extraction, which entails removing or losing your tooth. So most patients, you will find that they will want to go the extraction way, because maybe it is the easiest way, it's a quick way to relieve them from the pain they are experiencing at that moment, or simply because it is due to financial constraints. Because most circumstances, in most facilities, tooth extraction is way more cheaper than other procedures. However, I want you to get to understand that the extraction might look cheaper initially, and I want you to underline the word initially, but then in the future it has some complication which it brings along, though not always, but in most circumstances that can make that decision be much more expensive in the long run. If it is the only way possible that you need to get an extraction done, the tooth is not basically savable in any way, then don't feel bad about losing your tooth. And it's unfortunate that most people out there have bad reputations towards root canal treatment. One, maybe because they're expensive, they take a lot of time. Some people wonder even, does it really work? Honestly, in real sense, you can have root canal treatment done in a very comfortable manner. And that is why I really insist on getting a good qualified practitioner to have the procedure done on you, to avoid being one of those people with such negative reputations. So that being said, I want us to look on the pros and the cons of each. So the advantages of a root canal treatment include saving your natural tooth. Honestly, nothing is as good as having your natural tooth. As much as your dentist will advise you to get a crowning done after the procedure of a root canal, the fact remains, underneath that crown is your natural tooth. You cannot compare it to a crown and bridge or an implant. Number 2, it saves your teeth from drifting. Another advantage is that it saves your opposing tooth from being supra-erupted. Another advantage is it's less costly in the long run. And lastly, it saves your bone level. The disadvantages of a root canal: 1, it looks costly initially. Number 2, if the root canal procedure is not done well, or if the nerves inside the tooth are not removed well, the infection might make your tooth to ache at some point, making the prognosis of the treatment to be poor, even if a retreatment wants to be done. Also, another disadvantage is, in many circumstances, root canal treatments makes your tooth weak and vulnerable to breakage. So the best way to outdo that is by investing in a good quality crown. So for the extraction, the disadvantages are: 1, it looks very cheap initially. Number 2, it helps quick relief from the pain. However, the disadvantages include it is more expensive in the long run. Another disadvantage is that it is more involving and requires more work at the end of it all, because now you will be working towards making your tooth, or rather preventing your teeth from drifting and making your opposing tooth from being supra-erupted or so. Another disadvantage is it can cause changes in your bite as well. Also, it can make the bone that was once intact to the tooth start losing its volume and mass. That being said, for those of you who are not yet decided between getting a root canal or an extraction done, you have the pros, and the cons. You can choose whichever is good for you. However, from a professional opinion, I will advise, if you are in a position to get a root canal done, it is better to get it done, because nothing is better than saving your natural tooth. However, if extraction your tooth is damaged extremely and extraction is the only way out, then so be it. You can go and have the extraction done. So I hope I have really answered the question well. Until next time, have a nice one. Bye bye. Thank you.